Hello, welcome to the Let's Talk Kids Health live show, episode 55. I'm Dr. Nerissa Bauer, your host. I'm a behavioral pediatrician and CEO of Let's Talk Kids Health. As you know, the concept of the show is to share information about behavioral health, parenting, and family wellness. Each week, I bring you topics and guests to help me advance this mission so that we can all talk together. Now, let us know that you're here by commenting, asking questions, and liking at any time, and in a little bit, if you have questions, it will be asked of my guest. Now, as you know, the replay will be immediately available after the broadcast. So, again, if you're watching this and you're like, oh, shoot, I wish so and so were watching, well, then just share the episode because sharing is caring. And if you don't want to miss future episodes or maybe check out some of my past ones, please subscribe to my YouTube channel, NerissaBauerMD. Follow my blog Facebook page, Let's Talk Kids Health, and join my free parenting discussion group. Now, unfortunately, we had Dr. Allison Escalante scheduled to come on today, but due to unforeseen circumstances, we are postponing her episodes. But don't worry, she's going to come back and we're going to talk all about parenting without worry. However, today's topic will be just as awesome and so needed. I want to introduce you to Dr. Tammi-Marie Phillip. Dr. Tammi-Marie is a board certified child and adolescent psychiatrist. She was born and raised in St. Lucia. She completed her training in the US and now resides with her husband, two daughters, and dog in Rhode Island. Dr. Tammi-Marie is committed to improving mental wellness in children, adolescents, and young adults. In her spare time, she enjoys boating, traveling, and hydroponic gardening. Welcome to the show.
Thank you so much. I'm so excited to be here.
Oh my goodness, I am so excited to have you on. And I will be honest and tell everybody we just met, recently, but I am so grateful to have met you. Your energy is so welcoming and so warm. So
Oh, you. Thank likewise.
so I am so grateful to you for, coming on board, agreeing to come last minute on the show. Thank you so much for doing that. And to talk to us today about such an important topic. I mean, I think you as a child and adolescent psychiatrist, I myself as a behavioral pediatrician, there is a tremendous amount of kids suffering out there, kids and caregivers alike. We've been living in this pandemic with no sight, in end in sight. Sometimes it feels that way. And I know that we talked about this earlier when we were not live, that just there's so many kids out there with anxiety, depression, and they're struggling. So could you help me kind of set the stage a little bit? Like what are you seeing in your practice or your prior practice? And then we're going to go from there.
Yeah, and thank you so much for giving me the opportunity to speak about this. Talking about mental health and mental wellness is so near and dear to my heart. And so any chance that I can to talk about it, I get so excited about. But it's been rough. It's been from the start of the pandemic. I think everyone's been struggling. We've all been struggling, but I think kids and adolescents have been struggling a lot more. And, we've seen it being reflected in the numbers of kids that we were seeing. So, before I worked on an adolescent inpatient unit, and our numbers were through the roof. We had kids waiting for beds for weeks. We had kids who being discharged from emergency rooms who needed higher levels of care but just couldn't get into the inpatient units or the outpatient programs. There's just such a huge need and not enough resources to go all the way around. But I do think one of the things that has come out of this is just there's been so much more focus on mental health. And I think that the conversations have been going and people have been really interested. And so I think that's how we can really gain some momentum and get kids the care that they need.
Yeah, I mean, if anything, this pandemic has really helped us just talk about it more and then work as a society
Yeah.
to get that help, even though sometimes it can feel like it takes a long time because wait lists are long and.
Yeah.
But that's why we're doing this show. That's why people like us are kind of committed to kind of doing this work
Mhm.
because we need to be able to help our young children. So let's talk about, what are some of the warning signs for mood disorders?
Yeah. So, I think when I think about the warning signs for mood disorders, I think about in different age groups, right? So you have the signs that you would see in younger kids may be very different from what you would see in adolescents. But in general, you're looking for any changes. So whether that be changes in appetite, you're looking at changes in sleep. For kids, younger kids, we tend to see more physical symptoms. So we tend to see more like headaches and stomach aches that can't really be explained medically. You can get that in adolescents as well, but we tend to see that more of that in the younger kids. We see, changes in mood, more crying spells. Little kids, we tend to see more irritability, being more on edge. Adolescents may present as being more sad, more depressed, but a lot of times we'll see some isolation. We'll see, withdrawing from social activities that they really enjoyed before. Just, and when we say, we're going to see those changes, right? So just because, we see it for a couple minutes in the day doesn't mean that that's a huge warning sign, but it's when we have a consistent pattern, when it's over the span of a couple of weeks and we're like, something is off. And I think as parents, you know when something's off, right?
Mm-hmm.
And it's always important that you trust that instinct, even though you don't know what it is, but always trust that.
Yeah, that's such a great kind of just general overview of and a lot of warning signs are possible.
Mhm.
And that I think that's one of the things that's most confusing for families. It's because, what we're asking them to talk to us about may be in any other circumstance,
Mhm.
you know, a normal thing,
Yeah.
but what you just pointed out is that it needs to be for a certain period of time and
Yeah.
a change from how they normally are.
Yeah. Yeah. And I think that's what's key with it, right? Especially with adolescents. They're gonna have ups and downs, their moods are gonna be kind of all over. But it's when you have at least a couple weeks when you notice, okay, something's feeling off. And I think that's when it's important to really check in with your pediatrician or whoever is providing care, because then we may not have the words to describe it,
Mhm.
but I think that's where the conversation can start. And I think you know your child best as a parent,
Yeah.
right?
Yep.
And it's important to get in there as soon as you can.
Yeah. Well, so can we talk a little bit about this? Because I know that we touched on this, but are there particular differences in how they present depending on age or gender?
Yeah, so little kids will tend not to tell you that they're very sad a lot of the time. They have a lot of difficulty describing their emotions. And I think as parents, that's a place where we need to sort of step in and really teach kids from a young age, all kids, how do you identify your emotions and how do you express your emotions? Because that just sort of clears it up a lot.
Mhm.
Then in adolescence, kids are more able to talk about their feelings. So they're able to sit down with you and say, yeah, I've been feeling more depressed. I've been feeling more sad. I've been crying more. I've been feeling more anxious. Something that I've seen a lot of recently, especially with the pandemic, is kids not being able to get back into schools. And so we've had a lot of kids who've had very, very high levels of anxiety, and with schools being shut down, got to stay home and sort of got into that comfort zone of staying home, and breaking out now and getting back into life has been very, very difficult. Adolescents tend to be able to describe that a little bit better. With
Mhm.
younger kids, we'd see things like a lot of headaches, well, my stomach hurts, I can't go, just a lot more of those physical type symptoms.
Mhm.
Then we also see some changes with differences with gender. So our girls tend to be a lot more vocal, a lot more verbal with describing how they're feeling. They'll talk to you a lot more about it. Boys, it presents a little bit differently a lot of the time. And so, it a lot of times we find it more difficult to get as much information. But what we do know is that our boys are struggling just as much as our girls. And what's very concerning is that, girls tend to have higher rates, and the prevalence of depression and anxiety among girls tends to be higher, adolescent girls, but boys have higher rates of completed suicide. And so we're missing something. We're missing
Mhm.
something. And we have to, even though our boys are saying, we're good, we're fine, we have to keep communicating. We have to keep talking about it, and we have to keep on top of those warning signs that we may see.
Mhm. So for those of you who are tuning in and watching, if you have any comments or questions, please don't be shy. Put it in the question box right with the post, okay? Now, that's a really good reminder because I think one of the things that, you know, I hear is, wow, I want to talk to them, but they immediately shut down or they get angry or they say don't talk to me or they just they don't know how to elicit more information. So that leads me to like, what can parents do if they're concerned?
Yeah, the number one thing is try as hard as you can to communicate, what in whatever way that may be, whether when you're in the car going to school in the morning, if you guys eat together, trying to communicate. And I think it's also important to share with our kids, like, yes, I'm scared too. This is different. This pandemic we're living in feels very strange. At times I get worried. At times I feel sad about it. It's okay to sort of normalize those feelings that we're all experiencing as a way to sort of open up the lines of communication. If kids aren't speaking and you're trying, then I think at that point it becomes really important to then turn to your village. And I'm a strong believer we need a whole village to raise a child. It's not just child and parent, it's an entire village. And whether that be your pediatrician, your family medicine doctor, whether that be school, a lot of people don't realize that a lot of schools do have resources embedded within the school system that can be incredible help while you're trying to get into any sort of formalized treatment. So it's important that once you see those, that you're reaching out for help. The best case scenario, you don't need anything, but it's always important to intervene as early as possible.
Yeah, and that's so good. That's so important. I think reminding folks watching that the school resources are there. I mean, our kids spend so much time in that space, and it's only fitting that we try to reach out to that setting because they are there to help support our children as well. And I know that that's becoming even much more acceptable, right?
Yeah.
To have social emotional learning, to
Yeah.
have mental health counselors embedded. There's training for teachers so that way they know what they need to do on the spot. So, very good reminder, as well as going back and talking with your child's pediatrician or, just to gather more information.
Yeah. And I think that's always the first place where you want to start.
Hmm.
Always being like, I am seeing this. I'm not quite sure what I'm seeing. This is what I'm concerned about. Can we
Hmm.
have a conversation about it? And then getting pointed to the right direction
Yeah.
of what needs to be done. And within the school systems, going back to that, there are a lot of schools now that have like mental health clinics embedded in school.
Hmm.
So kids don't have to leave school to get any mental health treatment. And sort of having those newer curriculums where you normalize, mental wellness. How do we keep ourselves mentally healthy? And that's something that starts at a very young age, So that, but definitely reaching back to your pediatrician and saying, hey, I'm seeing this, I'm worried, what can I do?
Yeah. I mean, for those families who are watching this and we say mood disorders, it strikes me that maybe we need to take a step back and describe what is under that umbrella of
Yeah.
mood disorders.
Yeah. So mood disorders basically encapsulates a number of conditions that affect your mood. So that
Mhm.
could be things like depression, that could be things like bipolar disorder, but just any condition that affects your mood in a way that it's affecting your way of life and the way that you live your life. And
Mhm.
that's sort of how and then when you work with, one-on-one with your, mental health professional, your therapist, your psychiatrist, your pediatrician, then we can break it down further. Is this more of like a depression? Are we seeing more of a bipolar disorder or other conditions that can fit within the mood disorder realm? But it's
Mhm.
really about how is your mood affecting your daily living?
Mhm. Yeah, and I think just to mention, since I'm a behavioral pediatrician, just for the families who are watching and may not know exactly what to ask for, again, reminder that just, talk about what you're observing, even if you're not sure if it's going to be really important, it could be. And then
Yeah,
your pediatrician will be asking guiding questions so that they can kind of think through what they need to know and
yeah,
inquire about as well.
yeah,
Bringing in any samples of schoolwork if all of a sudden grades are changing, those kinds of things, those are important. And then you might be asked to fill out a screening form.
yeah.
And some of those can be for anxiety, some can be for depression. And then making sure you and your doctor talk through it and then decide on next steps.
Yeah, I mean, I would get so many calls from parents just saying, "Hey, I noticed that my daughter she seems more sad. She's in her room more. She's not eating as well. I don't know if it's anything. Could it be something? But I just want to make sure that, if it is anything that we can get her some help." Just exactly what you said, just describing what you're seeing and then going from there can be incredibly helpful.
Hmm. For families who might be sort of also concerned but don't have buy-in from the child,
Yeah, we see
can we
that.
talk about that? Because I think parents are a little unsure. Well, I want him to be present or I want her to help and be part of that conversation, but they're also fearful that it can, like, bringing it up and saying, "Oh, we're gonna go to the doctor so we get," like it's stress producing. But how, like, do you have any tips for families on how to navigate that initial discussion?
Yeah, and I think talking about I think that sort of comes to the communication piece, like talking about the importance of mental health and mental wellness is something that we need to keep doing with our kids all of the time.
Yep.
And so and this happens, believe it or not, there are a lot of kids who don't want to engage in treatment, but it's really about, saying, listen, I am really concerned. This is what I'm seeing. And I am your parent and I'm concerned about this and I'm confused and I want to get us some help as a family. And this is what I've found that could be helpful for us. And then it becomes when the child meets with the care provider, then they can go from there. And there are really wonderful therapists out there who do the most amazing work with kids who don't even want to be engaged in treatment, but can really get that buy-in and can make some progress. But I think it all comes down to making it something that we talk about. It's been so stigmatized for so long. Mental health has just been kind of swept under the rug and we don't talk about it. If we don't talk about it, maybe it doesn't exist. But having these conversations from very young, I have a 3-year-old and a 5-year-old, and we talk about, they're probably tired of it, but we talk about feelings all the time and what they're experiencing and how we deal with feelings. And having those conversations from young and carrying them forward can also be very, very helpful.
I love that.
Yeah. And one thing I will say too is don't be afraid to ask the hard questions. And that's where I meet a lot of parents who get very anxious about asking questions, especially around safety, especially around substance use. And my advice is just ask. You have to be direct. This is not something that we want to play around with. This is something we need to know. And asking your kids directly, are you having thoughts about hurting yourself? Are you using any substances? Is the way. I think beating around the bush, trying to get the answer is never really helpful. We want to normalize asking our kids very direct questions so we can help them in the best way possible.
Yeah, no, I think that's really important advice, and recommendations, because I know that a lot of parents are a little bit, they are anxious when they need to have that, like, heart to heart with their child, but just being direct, I think, is
Yeah.
the best thing.
And just saying things like, I know that you've been feeling really sad and we've spoken about this. Sometimes when people feel very sad or people feel very anxious, they can sometimes have thoughts about not wanting to be alive or hurting themselves in some way. Is that something that you've experienced or something that's happened to you? As a way to sort of, ask the question directly and get the information, but the kid doesn't feel like they're being attacked with those questions,
Yeah. So we did have one question come in. Thank you for posting this. So, what do you recommend if we were to see red flags on the friends of our kids?
That's a tough one. So I think you'll get many different answers to this.
Hmm.
Depends on what red flags you're seeing, right? And so I know a lot of parents and they've seen signs in their kids have gone to the school and say, listen, my child has been saying that their friend X has been, showing these signs. We're very concerned. Just wanted to give you that information. Depending on if you have a relationship with that parent, having that conversation with the parent directly. Like, I think I'm a parent, and if somebody saw something about my child, I would want to know. I would want somebody to come and tell me. I would want somebody, because it takes a village, but not everyone's like that. But I think starting with the school and saying, listen, I've heard this, I'm very concerned about this. And then if you have that relationship, going to the parent would be where I would start.
Yeah. Yeah, I agree with that. It is hard and tricky, especially if it's somebody you know personally. However, just thinking about if it were me and it was my child, I would want my friends to tell me.
Yeah.
It's not up to them to necessarily investigate. They just need to inform, and then, then I can take the appropriate action, right, to just check in.
And, I think one of the things that we've seen a lot is sometimes parents are the last to know. And that's one of the differences we see when kids are depressed versus like adults are depressed. Kids can look great in different settings. They can be with their friends and they look happy and they're enjoying themselves, and they can look sad at other times. And parents are like, well, they can't be depressed because they look so happy when they're with their friends. And but they can be. There can be. And kids a lot of times are not as open with their parents as we would like to. And a lot of times parents are the last to kind of know how their kids are feeling and doing. And that's why I think it's important, if we're hearing things, if we're hearing things from our kids about other kids, that we're sharing that information.
So I'm going to ask this question, and I just kind of made me think about like, what role do you think social media has, especially with our teens,
Oh my
our
God.
tweens, and
Oh,
mood disorders?
I mean, I can tell you, I'm so happy that I grew up in a time without social media. It's such a hard thing to navigate, and the amount of bullying that's happening online, the exploitation, um, it hasn't helped. I think being a teenager in itself is hard, right? Just by
Hmm.
definition, you're really learning to become your own person and how you become an adult and how you live in this world and become more independent. And now you take all of these extra pressures put on you, all of this extra thing, and people are even meaner when they can't be identified, right? And so it's such a difficult thing to navigate now. And if I think it's significantly in fact impacted the mood disorders that we see, the the suicide rates that we see, the level of substance use that we see, all of those I think are very strongly connected to social media. There, as parents, that's where it becomes ticklish. You can you just completely take away social media, and when you turn 18, okay, here you go into the world, figure it out. I think you need to sort of teach your child how to be safe with social media, but knowing that there's this little devil here that's very difficult to manage.
Yeah.
But definitely it's impacted everything that we're seeing.
Yeah, thank you for saying that because I can't tell you. I mean, I know that pretty soon my children will be more technologically savvy than I am, and that just
Look, mine are
happens.
already.
Yeah, that just happens. But I think what you just said about we can't just wait till they're 18 and then expect them to sort of figure it out. I think we need to, as parents, make use of the time we have with them. And even though it can feel unsettling for us either because we just didn't grow up with it or it's a new thing, it's foreign to us. I think if because of just how pervasive social media is and technology use is, being okay and leaning into that a little bit, discomfort is okay. And then being able to say, you know what, I don't really understand this. Maybe you can show me what it is you like about it.
Mhm.
And that way we can learn together.
Yeah.
But then that way you're sort of co-viewing, co-monitoring, starting that conversation, showing interest in something. And, I always counsel parents on setting expectations so that way if for some reason you get in there and you're like, okay, I don't really like how this is being used, I want to take it away, at least then you kind of have that buffer, like
Right.
if you set
Right.
that expectation. But I love common sense media. My kids know that if they ask for a request for an app, my my knee jerk reaction is never going to be yes.
Mhm.
I always tell them I'm building in some time for me to look into it
Mhm.
first so I can
Yeah.
understand what it is. And if I do agree, then there's like a grace period where I'm on there too with them and figure it out along the way. But I can always revoke if I see anything that I don't, think is okay.
I completely agree. I think, we could go the route of protecting them and say, no, you're not going to do this. They're still going to use it. They're going to find a way like that way.
Yes.
Right. And once you can have these open, honest conversations, then you have that buy-in and then you can figure it out together. And, it's wonderful when a child can come to a parent and say, listen, I'm struggling with this. Can you help me? Or like, how do I do this? Right. And I think it's things like that that sort of help build that relationship.
Hmm. Yeah, and it's reminiscent of like even if and I want to be very respectful of each individual family's values and what
Mhm.
they believe in, but I know that especially with technology, there are families that try to shield their child, whether it be like no cell phone until grade 8 or higher, but when they go to their friend's house or at school and technology everybody else has it, and how do you prevent like them seeing things through their friends' device? It's like this slippery slope. It's really hard and really stressful for families to
You know,
navigate.
I think it's really about teaching our kids. So when because they're going to get into situations like that, right? They're
Yeah.
going to be in situations where they're going to see things they shouldn't be seeing, or they're going to be offered substances that they shouldn't be using. And it really, all we can really do is really provide that safe space for them
Hmm.
before and teach them and do all of that work. Because I think sometimes if we say no, 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 but we don't give the information behind it, then that also doesn't help.
Yeah. And I guess just to kind of close out this conversation around mood disorders, we talked about the importance of, trusting your gut.
Yep.
If you have a concern, talking to your pediatrician, a professional about the school,
Mhm.
gather more information, talk to your child about doing the next step. But let's say there is a concern.
Mhm.
I mean, what can families expect, kind of in
Yeah.
broad strokes?
So if there is a concern and that you speak with your pediatrician and the thought is your child needs therapy or potentially needs some sort of med management in addition to the therapy, there are many different things. So unfortunately, the wait lists are very long to get in with a lot of mental health professionals. Unfortunately, there are just not enough resources. But the first place I would start is with my pediatrician. And are there any therapists that they work with? Some pediatrician offices have therapists embedded within their practices,
Hmm.
which are helpful. Definitely the schools. I think there's been a big push to get more mental health support in schools, and so
Hmm.
whether it be that they're seeing like a counselor, or therapist who may not necessarily be doing therapy with them every week, but can keep a closer eye on them to make sure that things aren't sliding downhill too quickly.
Hmm.
Definitely trying to get in to see somebody in the meantime and working with your pediatrician. A lot of pediatricians now feel comfortable prescribing antidepressants if needed, anti-anxiety medications if needed. So you don't have to wait, the 6 months or ever how long it is going to take to get in to see the psychiatrist.
Hmm.
You can actually start a lot of that work there. And what I will say is that if there's ever any safety concern, take your child to the emergency room. Have somebody independent evaluate them and see if there's something more that they need, because there are other levels of care. So there are things like partial hospital programs where your child can go spend a few hours each day, get a very high level of care. There are intensive outpatient programs, and having the hospital can sometimes facilitate that a little bit quicker. But anytime there is any concern, go to the emergency. If any big safety concern, go to the emergency room. The
Hmm.
most they can say is, okay, your child's okay. We'll set you up with this, but you don't want to be on the other end and say, I wish I had gone to the emergency room.
Right, right, for sure. And then one other quick recommendation is to program, the suicide hotline number in your or crisis phone, center in your phone, just in case.
Yep.
If your child does have depression, even if it's on the more mild side, I always just sort of try to be proactive and just, it is a scary thought, but in the moment, if for some reason something happens, the
Mhm.
child escalates, I don't want parents to feel like, oh my gosh, what do what do I do?
Right.
So, just having those things readily available and talking
Yeah.
through like what are the contingency plans?
Right. And exactly what I was just going to say. I have a lot of parents who I've worked with who say, okay, if we have to go to the emergency room, and it's written out and it's on their
Hmm.
fridge, and they know exactly this is what we're bringing. This is who we're calling to help with this. This is exactly what we're going to do. So it organizes a chaotic process as much as possible.
Hmm.
And a lot of kids, if there are safety concerns too, working with whoever is providing the mental health on a safety plan and having and family be part of that safety plan, so everybody knows what's on that safety plan. You're not feeling that great. Okay, let's kind of revisit it and see what we can do. And another tool that parents find very helpful in terms of safety planning and communication too is sometimes I do a rating scale with kids. So let's say you're going into your daughter's room. She doesn't look great. She doesn't want to speak with you. You guys have a deal. She'll have to give you a number between 1 and 10 of how she's feeling. So numbers mean different things to every family. But let's say a 8 means I'm really depressed. I'm feeling a little bit unsafe, but I think I can be safe. Then okay, you know what? I don't know what's going on, but I'll keep a closer eye. If they say I'm at a 10, that could mean in your plan, I'm feeling very unsafe. I don't care what's going on. I need to take you straight to the emergency room.
Hmm.
And the goal of that is in the moment, kids may not feel very comfortable talking about what they're feeling, but they'd be much better able to give you a number. So you as a parent know what you can provide in that time to help them. But the goal is that eventually, not too far down the line, that you guys sit down and have a conversation about that moment and what was happening.
Hmm. Yeah, no, I love that suggestion. And so, just so that way, the folks that are watching, I think it's really important. It's in when you do establish that rating scale,
Mhm.
like you said, different numbers can mean different things, but actually, again, it could be with the doctor present, right? But talking through, like, if it were a 1, give me an example of how you'd feel, an
Mhm.
example of a 10, an example of 5, and sort of just make sure that everybody's on the same page about what those numbers mean.
Yeah. And another tool that we use a lot to help with communication, especially with adolescents, like a family journal. A lot of
Mhm.
kids find it easier to text their feelings
Yes.
instead of sitting face to face like this. And literally, you could just be getting a notebook, and I will write exactly how I'm feeling, something difficult I'm going through. You, as a parent, take it, read it, process it, write an entry back. And it takes away a lot of this face to face sort of discomfort when people can get more defensive. And it really can open up the lines of communication significantly.
Yeah, I love that idea as well as the texting. I mean, I think a lot of teens are well versed in that and they prefer that sometimes.
Yeah.
So, I mean, sometimes you have to meet them where they are, right?
Yeah.
So, yeah.
Yeah.
Yeah. Well, so any last minute suggestions or strategies for parents or any other thing that we didn't touch on?
I think really it comes down to just trusting your gut. I think as parents we have a sixth sense and we know something's off, and don't, follow that. Follow
Mhm.
that and just know that there's help out there. It might be sometimes feel like it's difficult to access, but there is help out there. And just continue to work with your pediatrician, continue to work with your team, and we'll get there. But it's a time when everyone's struggling, and kids in particular are struggling, but we all have to come together to help them.
Yeah. So if I had to recap, I hope I get this all right. 1 is communication is paramount. 2 is normalize talking about emotions from as early as you can. Focus on mental wellness, take that stigma out,
Mhm.
and do it during, family conversations in the car. Just talk about it. Just get comfortable with talking about feelings, the good as well as the not so good.
Mhm.
Yep. And then number 3, if you're concerned, make sure you reach out to someone on your team. So your pediatrician, a tutor, like a teacher, and a trusted adult, and try to start that conversation with your child. But know if you get pushback, there are lots of other fun ways to engage with them that can remove that pressure using a journal, texting, and or just going to the doctor
Mhm.
and starting that conversation. And then, thinking about safety
Yeah.
plans,
Yeah.
imminently, especially if you can't get in to see someone right away, and just, having that trusting your gut,
Yeah.
right?
I think you got
Yeah.
it.
Okay, good, good, good. So, just for those of you who are watching, I'm going to be posting some resources too that I thought I would share. Um, one of them is the Take Note from understood.org. I actually helped with that launch. It's a nice digital tool. It's in English and Spanish. It just basically helps parents take all the thoughts that they're seeing, the observations, and putting it on a document. So that way, when you do see your pediatrician,
Mhm.
who might not have as much time per
Mhm.
visit, but they definitely want to hear about this, it helps you feel like you can share what you need to share in that time. And then also on my own website, I have something called Prepping for Your Behavioral Visit, again, with similar kind of prompts to help you kind of capture all of that information so that you can share it.
That's great.
I have a comment. Oh, I love the pillow that you have in your office, Dr. Bauer, with all the feeling words. We have that one too. I know. So see things like that. You can have it around and normalize feeling talk, right?
Yeah.
So it's so great. Thank you. So anyway, I have really enjoyed this conversation. And before we leave, I do want to just remind everybody who's watching that next week's guest is Tina Mathams. We're going to be talking about stress-free mornings with neurodivergent kids. Who does not want a stress-free morning? And for those of you who are watching and want to like have a topic or a guest that you'd like me to interview, please send me an email at drnerissa letstalkkidshealth.org or reach out to me on any of my social media platforms. And you know what? It's tomorrow is it's February already. Oh my goodness. You know what that means? February Book Club. So it is Raising an Organized Child by Dr. Damon Korb, one of my really good friends, also fellow developmental behavioral pediatrician. Great, great book. I highly recommend it. And as you know, if you've been on my parenting book clubs before, you just got to get a copy and then just start reading it. There'll be prompts in the Facebook group, and then Dr. Korb is coming. to do a virtual author chat. So please keep that in mind. It's really helpful, especially for families with kids with ADHD. All right. Well, thank you so much, Dr. Tammi-Marie. It is such a pleasure, and I can't wait to continue talking with you, getting to know you. This was so helpful.
Thank you. Thank you so much for having me.
Oh, yes, it was my pleasure. And everybody else, tune in next week, and we'll talk to you later. Thanks.